Good morning and or good afternoon if you're on the East Coast. Welcome to the Wednesday, March 18th edition of Broadband Breakfast Live Online. We are live and streaming to YouTube, to Twitter, to Facebook, and of course to broadbandbreakfast.com, where we've been reporting on the impact that broadband has had and can have in helping to alleviate the coronavirus. I just wanted to give a special thanks to Blair Levin, John Windhausen, Olivia Wine. Is that how you say your name, Olivia?
Yes.
And also to those of you who are watching us here. Thank you again for being part of this discussion. This is in some ways a fast-moving experiment to confront or to deal with a fast-moving challenge that our society is now facing in the coronavirus. And we launched our first Broadband Breakfast Live online last Friday, less than a week ago. And we had a great audience and even greater audience afterwards. And I just wanted again to reiterate, we're going to be here every Monday to Friday at 12 noon Eastern time. We appreciate those of you who have watched. Share the link, share the information about it. You can always find information about the upcoming events on Broadband Breakfast, and as well as the different social media channels. So with that, I want to turn to our three panelists that we've got for today's discussion. We're going to be speaking about the FCC and emergency measures that it has taken or can take in this situation, this challenging situation. I'm going to turn first to Blair, who, whenever I think of a wise old man in the telecom space, I think of Blair. Not that he's out of it; he's very much engaged in the issues, but he has a real depth of experience on all aspects of the FCC and telecom. And that's one of the reasons that I'm very happy that he can join us. Blair will have to leave at 12:45, but John and Olivia will be with us until 1 o'clock. So Blair, just by way of extremely brief introduction, you were, of course, Chief of Staff to the FCC chairman under the Clinton administration. And then you have continued to follow this issue. And, 10 years ago, you came in to head up the National Broadband Plan, which celebrates its 10-year anniversary this month. Obviously, that's taken another turn recently. But I'm actually wondering if you could start off with that experience, because if I recall correctly, there certainly were public safety and emergency aspects to a national broadband plan. So would you be willing to speak about the National Broadband Plan and the moment we're in right now about broadband and how it can help provide solutions to this crisis we're in?
Sure. Let me just start by saying that I'll actually be publishing a piece on the 10th anniversary on the Benton website probably later this week, and a bunch of other people will be doing the same thing. Not so much to comment on what we did, but to kind of lay out an agenda for what a next national broadband plan should be. And I think this virus, in an unintended way, will really create a stress test for our national broadband networks. And it will expose some things that I think will show that we've made a lot of progress. It will also show some things where we haven't. In a way, I think if you go back 10 years ago, if this crisis had arisen, the thought of everyone working remotely, the thought of doing what we're doing now, the thought of kids learning at home would have been laughable, because the average download speed was 4.1 megabits. Couldn't have done it. Just wouldn't be possible. Now the average speed is 96.25. That number may be deceptive in some ways. And I note the irony that in the fall, the Wall Street Journal ran a story saying Americans are buying too much bandwidth. They don't need it for what they're using it for. We'll test that. We'll see that. I don't know how it's going to go, but I suspect for most Americans, based on the European experience today, the networks seem to be doing okay. But there are, three big problems, right? And those are the three big problems we dealt with in the plan. And, we made progress, but we're not in the promised land yet. Problem number one, access. Our networks everywhere. They aren't. I'm actually midterm optimistic that a result of satellites and things like Microsoft's Airband initiative and some 5G initiatives and some other things really are with fixed wireless. We'll get there, but that's 2 to 3 years away. In the interim, very difficult to do much, though there are some things that can be done to improve access on an emergency basis in certain areas. The second problem is adoption. I've said for some time we have been under investing in that, and I think that that's clearly the biggest hurdle for this crisis is where you have people who do have access to a network but either can't afford it or aren't digitally literate or have to date seen it as irrelevant. Um, that's a big problem, and there are various things the commission has done on that, which I would argue they probably should have done even without the crisis. But that's that's a debatable point. The third thing is utilization. This is actually where I think the biggest digital divide from the perspective of 2030 is that, and it's hidden and no one is talking about it. It's the divide between what we should be doing on broadband and what we are doing. And we laid out in the second half of the broadband plan various tactics in terms of national purposes, education, um, healthcare, public safety, public health, which is a different category, job training, a number of other things that we thought were important. We have not made as much progress as I would have wanted on those things. Um, I do think there are certain categories, and John knows a lot more about it than me. Like in the schools, we have made significant progress in connecting the schools. I don't think we've made the same progress in improving educational outcomes. But I actually think this is a crisis, and a lot of innovation comes out of crisis. We are going to see how to really utilize broadband, not just for remote learning, but how to improve learning. So I'll just close by saying that, again, John and Olivia know a lot more about short-term tactics that can be useful, but I hope that the Congress and others, when we're through what might only sadly be the first phase, that is to say, in the next 2 to 3 months, that we do take the opportunity to actually learn what happened, how did our networks perform, where are the gaps, not to blame anybody, but rather just to understand better what's really going on, and very significantly look at what are the innovations that developed, what school systems were able to do it well, so that everybody, when the next crisis hits, or even without a crisis, can better utilize broadband, and we can really achieve the vision, which is to make sure that access to affordable, abundant bandwidth doesn't constrain economic growth and social progress, whether in a crisis or outside of a crisis.
No, thank you. That's excellent framing for both the National Broadband Plan's 10th anniversary and how the state of broadband is affected by this. I want to come back to you in a few moments, Blair, about some specific things the FCC can or has done. But let's keep going around our squares here and hear from John Windhausen. John is the executive director of the Schools, Health, and Libraries Broadband Coalition, some affectionately known as the Shelby Coalition. And Shelby Coalition is a partner and sponsor of Broadband Breakfast. Very happy for that association and very pleased that, John, you've been able to join us here to talk about different aspects. And we will talk quite a bit about Lifeline. But what's first and foremost on your mind every day, John, as you're addressing the impact of the coronavirus and what broadband can do or needs to do to address it?
Well, thanks, Drew. And it's a great pleasure to not just be here with you on this webinar, but also to be a sponsor of the great work you're doing at Broadband Breakfast. So I commend you for scheduling these webinars and focusing on these topics on such a, there really needs this kind of focus. I guess I would say it as a couple of introductory comments that, Blair did a wonderful job putting the National Broadband Plan together 10 years ago. And if we had actually implemented everything that had been recommended, we'd be in a far better situation today than we are. A lot of the goals that were set in the National Broadband Plan called for things to be finished by the year 2020, such as getting gigabit to all the anchor institutions around the country. And we made great progress in the last 10 years, but we really haven't finish the job. So if there's one silver lining, that's probably not even the right word to use to describe this crisis, because it's a big, tremendously human crisis, but it may serve as a stimulus, if you will, to our thinking to be actually to get the National Broadband Plan done, and to get broadband not just to the anchor institutions, but to everyone's home. We should have ubiquitous broadband that's affordable, that's high capacity, wireless and wireline everywhere. And I think Blair has also written in the past about the benefits of ubiquitous broadband. And we totally support that goal. Our focus is on the anchor institutions, but also on the ways that anchor institutions can serve their communities. And frankly, with the schools closing and students and teachers now being required to do what they can to deliver education to the home, home broadband access is our educational access. It is our telehealth platform. It is a way of interacting and socially communicating. So getting broadband everywhere is really, really important, and let's hope that we can make that happen here in the next few years and use this stimulus in a beneficial way. I was on a call early today, and I heard Angela Seifer from NDIA talk about the need for a connectivity stimulus. And I think that's exactly right. And that's what we should be looking at both at the FCC and on Capitol Hill. So there are sort of two ways to look at this, right? And we can go into more detail, but one dimension is what are the things that the FCC can do right now under its current authority? And we think there are a lot of things that the FCC can do to open up the networks that have already been built with public money. So the E-rate networks built to the schools and libraries, and the rural healthcare networks built to these rural health clinics, those are being built with public dollars. Everybody is paying for those networks, so it makes sense that the public should benefit from the availability of those networks. The FCC has power right now to open up those networks and clarify that those networks can be shared with the surrounding community. The standard at the FCC is as long as those networks are used primarily for educational purposes in the E-rate program, that also means that you can have some non-educational uses that are permitted as long as it's primarily for education. So the FCC ought to take an expansive view of opening those networks. So for instance, not just Wi-Fi connectivity at the school or at the library or outside the doors and the parking lots, but actually using those networks to extend wireless signals to the home. And there are things that like wireless hotspots, which I'm sure we'll talk about a little bit more, but that's just one example. The FCC can also take steps to help schools and libraries immediately upgrade their access to deal with the sudden surge in traffic that they're going to face as people deliver distance learning online. So the Shelby Coalition just sent a letter to the FCC yesterday with about 12 different recommendations of things that the FCC can do under its current authority. And then in addition, there are things that Congress can do. Congress is right now looking at ways to create some new funding opportunities and perhaps some new programs that could help to address this crisis and get broadband everywhere. So I know there's a tendency when this emergency happens, people look to the existing programs like E-rate, rural healthcare, Lifeline, but Congress doesn't have to be limited to those existing programs. It could consider using and creating a new program or a supplemental program, either through NTIA or through block grants to the states. And I think we ought to be thinking more broadly about what Congress can do here. And this may happen even in the next few days. So it's really urgent.
Excellent. John, excellent point, excellent frame there. The first one being, what can the FCC do within its current authority? And great to point to your letter with 12 different items, and maybe we'll unpack that as we go through a little bit this hour. But the second point, let me just highlight, is what kinds of new things, unbound by current frameworks, could Congress do? And to just follow up, what are some specific things you or others you've talked with, John, have thought of already that would not be, quote, bound by existing programs?
So it's important to subsidize broadband service, but it's also important to subsidize the equipment and the devices. Oftentimes consumers at home don't have the laptops or the tablets that they need I think one thing we've learned already is that trying to do homework based on a smartphone is not adequate. In fact, there was a study that just came out from in Michigan that documented that kids trying to do homework on their cell phones have the same impact as kids who don't have any broadband at all. But once you get a wired broadband connection with significant capacity that allows you to work on a computer or laptop, those students were able to increase their grades and showed better school performance. So that's been a most recent study that just came out a couple of weeks ago. So that's the kind of thing that we need to be thinking about, and Congress needs to be thinking about. It's not just the connectivity, but it's also the device, and it's also the digital literacy training to bring people up to on how to use these technologies. So there are bills in Congress, like the Digital Equity Act that the Shelby Coalition supports. And now is the time. I mean, we've heard already the Trump administration saying money is no object or no barrier to moving forward. So, but we need to be smart about how we spend that money. And we've already done some work to identify some of these problems, but we need to really ramp those up right now and try to get that done.
Excellent point. There's so many dimensions to this, to the way broadband serves in the midst of this coronavirus crisis. And, last Friday we talked about online education. We'll come back to this in one of our other editions. Yesterday we talked about the Keep America Connected, the plan to make sure that carriers don't cut people off for 60 days for non-payment, to make Wi-Fi hotspots more fully available. The equipment point you just made, John, I mean, all of these are resonating to different people's experience personally. I just drove over to one of my daughter's schools to pick up a Chromebook that's being loaned to people. And we're grateful for that, right? Because there's some computers, but not everyone's got a computer in a household with many people. So that's an excellent point that you've raised. Let's turn now to Olivia. Tell us just a little bit about the National Consumer, is it the National Consumer Law
Center.
Group? Center. Now, thank you. Sorry, apologize. National Consumer Law Center, and what you are focusing on at this time in regards to making sure that broadband can help or is not hindering people in their response to the coronavirus.
Thanks, Drew. And thanks for inviting me to be part of this conversation. I am a staff attorney at the National Consumer Law Center. We started out as a legal support center to help legal services help consumers, stay in their homes, stay connected to utility services, the basic essentials. And we have stayed very close to our roots. We just celebrated our 50th anniversary. I have been focusing on the Lifeline program and on the Universal Services program. And I should disclose right off at the start that I am also a board member of the Universal Service Administrative Company, but I am not participating in this conversation in that capacity. I'm participating in this conversation as a staff attorney at the National Consumer Law Center. The Lifeline program it predates the 1996 Telecom Act. It is a low-income federal program to help households afford essential communication services. Started out as wireline. With Katrina, it made the leap to wireless, and in 2016 added broadband. It is available in all the states and territories for households that qualify for certain means tested as Medicaid and food stamps, low-income veterans benefits. It also, you can income qualify at 135% of poverty. Right now, it is a modest benefit of $9.25 a month. And there's a definition and minimum service standards required. The broadband is a very modest package right now. You have to be an eligible telecommunications provider to participate in the Lifeline elements, because here we go with the moment we're in with families and individuals being told that for the sake of public health, self-distance, stay in the home. We think that broadband service is essential for people complying with that mandate, but I don't want to lose sight of the voice service as well. This is our first task. as I mentioned, Lifeline covers voice and broadband. We just got an email this morning through our legal services network from somebody who works in the community health centers in Tennessee. They are seeing seniors, low-income seniors, Lifeline recipients, show up at these community health centers when they do not need to show up physically. Had they called ahead of time, their needs could have been met through telehealth, but they are worried about their minutes. And so the first ask is, in this emergency situation, to the FCC, which they can do, is, allow the Lifeline program or require the Lifeline program to provide unlimited minutes and texting. This is important if you want people to, use the telehealth services to the extent possible to avoid unintentionally, spreading the virus or thing while they're in line, to be served. The second ask, and it's looking back at what happened with the Katrina response, when the Lifeline program moved from a wireline subsidy to expanding to wireless. The FCC waived the ETC requirement. It opened the door to sort of non-traditional players in this space. It also allowed for equipment. It allowed for handsets to be covered by the universal service subsidy. So, the FCC does have tools in its tool chest right now. It could issue an order immediately that could make a huge difference in improving the public health situation and improving consumers' lives. Moving into the bigger challenges we're facing with broadband access and quality broadband access, a robust sort of pipeline to the home. The Lifeline program, as I said, has the infrastructure. It's in all the states and territories available right now to consumers. The FCC has within its power to take a look at the structure of Lifeline and use its application process, its reimbursement process, and expand it to a more robust broadband subsidy. That can help. The carriers right now have stepped forward with these voluntary 60-day packages. It is entirely conceivable that this crisis could last longer than 60 days. We are looking forward, what is that next step? And how do we help create a system where low income or economic households, because we know a lot of households now are dealing with wage loss, can have the broadband they need to shelter in place and to comply with the directives of, the governors to stay put and to minimize going outside for your other needs. And so Lifeline can play the role in the broadband space, but it will need some action. And we believe the FCC has the authority to act now. And certainly with the voice issue, that is something that should be taken care of right away. We also heard from Angela Seifer from NDIA a story about one of the organizations in her network, a public housing authority. The workers are, going home to self-isolate, and the seniors left in this public housing, they're very conservative with their Lifeline minutes. They are not going to use the phone to its maximum capacity. They're not going to be checking in with the healthcare workers unless it's an absolute emergency because they're worried about running out of minutes. So again, this first step of unlimited minutes, unlimited texting right now is an immediate public health necessity. The second step is building onto that what happens after 90 days with these free programs.
Yeah. So thank you. That's two excellent suggestions on the getting rid of the minutes or requiring the getting rid of the minutes and the waive the ETC requirement, kind of expanding and allowing more robust connectivity by other entrants. We will come back to this Lifeline and specifics on Lifeline because I know that's been much talked about and we want to keep talking about that during this hour. I want to just go back to Blair for a moment and make sure we don't miss a couple other issues. For example, what about some of the authorizations that have been made in terms of spectrum and granting more access to spectrum? What about the deadlines that the FCC has. That's always a concern of many in the telecommunications legal and policy community is, is this deadline gonna change or not? The FCC is pretty much in a telework only mode right now. We've reported on this on Broadband Breakfast, and Chairman Ajit Pai is working from home, setting an example. He's also said, to Olivia's point, that he's disposed to extend that 60 days if situations warrant in 60 days, but obviously having some certainty now is important. But so for Blair, let me just ask, having been on the inside multiple decades at the FCC, what are some of the challenges that they're likely to be facing right now? And how what measures should they be taking to address this crisis right now that they haven't yet done?
Again, I think John and Olivia probably know more than me. Let me offer a couple observations, though. As to the spectrum, obviously there are certain temporary obligations. I know they granted one to U.S. Cellular. I suspect they will be very liberal, and I'm going to come back to that word in a second, in granting such things. Your second question had to do with
the second question, deadlines and the operation.
They announced already that they're going to, in terms of deadlines for certain repacking, they're going to be generous in extending those deadlines. I suspect there are a number of other issues, whether it be the build out of certain networks or, with the C-band auction. There's a number of things I think are relevant to particularly investors in certain companies, where I suspect that they will, essentially toll all deadlines. But I want to make a larger point here. As some people know, I support my pro bono habits by advising Wall Street investors. And a piece I wrote this weekend, I kind of headlined it somewhat tongue-in-cheek, but somewhat seriously, "We're all socialists now." That's a reference to a number of different things. But what's interesting about this crisis, and you see it with Trump offering $1 trillion, bailout, with people like Mitt Romney and Tom Cotton talking about $1,000 checks to people. I'm not disagreeing with them. I'm just saying that one of the things about this crisis is it has taught us something about the interconnectedness of all people, that someone else having a disease actually threatens us. And that is a transformative kind of thing. And you see it with the FCC, where, last Friday, Ajit went to the carriers and essentially said, "I want you to do things. I'm demanding you do things on a voluntary basis. And I have a right to do that because that's for the public good." Again, I'm not criticizing him. I'm just saying there's a reason why we make these demands of these networks. We're saying you have to open up your Wi-Fi hotspots to everyone. We're not going to Cisco and saying you have to give away your Wi-Fi routers. We're saying you can't do overcharges, you can't do disconnects. We're not making the same statements to the credit card companies. These networks, which were, John was referring to some publicly funded networks. He's absolutely right about it. A lot of the networks are privately funded, but nonetheless, there is a certain obligation, and we're going to be redefining that obligation in a variety of different ways, both in the crisis and I think outside of the crisis, because I think we're going to look back and say a lot of the things that we're going to do now, we have to ask ourselves, why weren't we doing them anyway? Since in the same way that if someone is sick, that can impede the health of all of us. If someone's disconnected, that can also impact our society and our economy in negative ways. So we really need to get everybody on.
Right. One of the points we've made in a prior Broadband Breakfast Live online is that there really is, we're going to re-examine a lot of our prior assumptions about education, about telework. Another question that's sort of still emerging is is it easier for the private sector to react than the public sector in this everyone go home moment, or are we seeing the same significant disruptions? I guess what I'm really asking is, Blair, and working with some of the Wall Street investors you've spoken about, is it as hard to communicate and to share information this time, or are you finding that our communications are still remarkably communicative?
No, look, I think there's, most of my communications are over the network. Most of Wall Street communications are over the network. The network seemed to be holding up okay. But I go back to what are the assumptions that we operate under? And by the way, there is a split. There's still a very significant split in this country. There won't be in a week or two about the seriousness of this problem. Uh, and that raises a whole new point, which is about to what extent do we need to take care that certain fundamentally false messages are delivered on the internet. I don't have a strong point of view on it, except to say that a lot of the stuff that I've read really looks to me like crying fire in a crowded movie theater, and that people, all kinds of it's either a hoax or they're selling false, um, um, uh, things to cure the virus, etc. This is a big problem for society. So we're going to look at this, and I have a feeling that when we really start looking at it, no one will say, let the private sector take care of it. Competition solves all problems. I think we're going to move away from that kind of analysis.
Interesting perspective. Let's kind of invite John and Olivia in on these broader points, and then we'll kind of drill back into some of the issues involving Lifeline. John and Olivia, how are your day-to-day lives impacted by this? How are you interacting with your colleagues and partners and associates, John and Olivia? Same for you. I mean, what are some of the issues? And thank you for raising this point about elderly people going out because they couldn't call ahead. On an education front, in addition to kind of addressing the FCC levers that you spoke about, Olivia, what are some ways to get those messages out to people and make sure that people are understanding the best practices in a world that's completely different than it was 2.5 weeks ago? So John, you first, and then Olivia.
Well, Drew, I'm fortunate. I have a good quality broadband connection at my home. I wish it were cheaper than it is. It's still too expensive than it should be, but at least I'm able to afford it. A lot of people in the country are not so fortunate. Either it's not available or it's way too expensive. Our calculations based on the American Community Survey are that there are something like 6 to 7 million students at home who do not have broadband at home. The number is not 12 million, as some of the policymakers are saying. That's an old number. But if you look at the most recent ACS survey, it's between 6 and 7 million. But that's still a big number. There are something like 50 to 55 million students in the country. So over 10% of our students don't have broadband at home. And that means that they can't get education, do online education at home. And that's really the only way they're going to be able to get schooling these days with the schools closed. And I think we saw Kansas was the first state, I believe, to order their schools to be closed through the end of this academic year, through June. And I suspect a lot of other states are going to follow. And, let's hope schools are back up and running in September. But, there's no guarantee of that. This could be, as we flatten the curve, as the saying goes, and reduce the spike in infections, we're also prolonging the crisis, and it spreads out over a longer period of time. So we have to think about not just what do we do today and tomorrow, but how do we get broadband to everybody's home for the start of the school year next fall, because we may be still in this similar situation.
Yeah.
So
sobering thought. You've spoken about the schools, in the schools, health, and libraries. Could you just say a word or two, and we'll get to you just momentarily, Olivia, about the health and the libraries, right? I mean, libraries are mostly closed now, but does that mean they're not shutting up their Wi-Fi? They're shutting off their Wi-Fi, I hope. What's your feedback on that? And hospitals and health organizations, how is broadband affecting them in this crisis, to the extent you've heard from your colleagues in that space?
Well, I hope the libraries are keeping their Wi-Fi open, even if they're closing the building. But not all libraries are able to do that. And one of the uncertainties is, both for libraries and for schools, is if they keep their Wi-Fi open to the public, do they lose their E-rate funding? They shouldn't. The broadband was justified for the schools and libraries to be at their premises, but there is an open question, and the FCC has not yet clarified. The FCC could do us all a big favor by clarifying and letting the schools and libraries know that if they open those Wi-Fi networks and keep them on, that they're not going to lose their funding, their E-rate funding, if they do that. That would be a big, important step for the FCC to take. On the rural healthcare front, there are also some easy things that the FCC can do right away. One of the most simple things they could do is extend the filing window for current rural healthcare applicants. And I know this sounds like a detail, but it's really impacting and preventing rural healthcare providers from serving their patients right now, because there's currently an April 30th deadline for the applicants to submit their paperwork to the FCC for the next year of funding. But many of them haven't received word on whether last year's application has been funded or not. And these are applications that were submitted last June. And it's, what, 9 months later, and they don't know whether they're funded. So they have to fill out applications applying again for the same funding that they already applied for. It's creating duplicative work for the applicant and for USAC, which oversees and administers that program. So we've asked the FCC to extend the filing window for another 2 months until June 30th, and that will help rural healthcare providers focus on the needs of their patients rather than filling out paperwork. So that's another simple thing. But beyond that, Drew, I think there are some bigger questions about how the growth of telehealth networks. I think we're going to see, we've already been seeing a steady increase in the demand for funding from the rural healthcare program, and that demand is probably going to skyrocket based on this current health crisis. So currently the rural healthcare program is the smallest of the 4 universal service funds, and it's capped at about $600 million per year. We think that needs to be significantly increased, maybe tripled to $1.8 billion per year, because we don't want any telehealth facility to be cutting back or holding back on its broadband connectivity for fear that the funding might not be there. The FCC should make clear that it is going to provide enough funding for all of these health clinics and hospitals to get the broadband that they need to serve their patients. And that's the only way to do that is to provide that certainty by significantly increasing the funding that's going to be available going forward.
Thank you for that detail. And we see a watcher, Lisa Shaw, has noted Maine libraries are keeping their Wi-Fi open. Thank you for that comment. And please offer your comments, listeners. Olivia, do you want to address the issues that
I think that Lifeline will be key. It's connected to the telehealth issue. It's connected to education. I too am fortunate to have good broadband service. I have 2 college kids that are home that are now going to be
sharing that bandwidth.
Yes. In fact, I think my daughter is streaming a class right now. So I was a little nervous about this. But I think really going back to some of these things that the FCC can do to facilitate, right, for the sake of public health and, to relieve some of the burden on some of these community health centers and hospitals, allow, get rid of, I should say, require unlimited minutes for the Lifeline program. Allow folks to call ahead. They shouldn't be rationing their minutes. They should, because they're afraid they'll be put on hold.
Let me just interject, Olivia. How do we get the message? Presuming that is changed, how do we communicate that to people that, don't stint on your minutes. You need to know things before you go outside.
I think it's going to take a coordinated sort of, social media campaign right now. How are people getting their news? To inject some public service announcements out there. There are ways that you can, get affordable connectivity, and here's how. Pushing out the voluntary packages, right? I don't know how aggressively those companies are pushing out or advertising what they're committed to do. That is really important, especially for the school-age kids right now. But again, and then the second ask that I put up there, which is, looking at this Lifeline program, do what happened in Katrina. The FCC could take this program, create a good Lifeline broadband subsidy, and help what happens after the voluntary programs end. Let's keep something going here. We can do it.
Yeah. Yeah. Awesome. I want to be respectful of Blair's time because you need to go in a few minutes. So we'll come back to this. I do want to dwell a little bit more into these lifeline proposals that John and Olivia, you've spoken about. But Blair, do you want to react to anything that's been said or say anything else that we haven't talked about, that things that the FCC can and should be doing right now?
If I were Jeet Pai, I'd be calling up John and Olivia and getting the full list. John, I hope you get a good answer to your letter listing those 12 things. Look, let me make just a couple points and then I'll hang up, and I apologize for having to do that. Number one, I want to thank John and Olivia for the work they've done, and Drew, that you've done. And I mean it in a couple of different ways. Number one, you're responding to this crisis in this way. But one of the most important lessons I learned in my life early on was from a Dominican, a Benedictine monk, actually, who was a professor where I was going to college. And he said, he was talking about world history and said, crises are brought about by the failure to work in the interstices, by the failure to work between crises, and then crises come upon. This crisis would be a lot worse if we hadn't had the work that John and Olivia, you've done to make broadband more widely available. But again, we're going to see those kind of glaring errors. It's important that we have a commitment both to deal with this in the crisis and then deal with it after the crisis, so that when a similar crisis arises, it doesn't, the costs are mitigated. You can't, this doesn't necessarily stop the virus, though I would argue that 10 years from now, we will have all kinds of applications that people will be wearing on their bodies that are likely to dramatically improve our ability to address things like this, because it's very clear that the real problem that we had in America was the lack of testing, and as much as social distancing is valuable, if we had had access to easy tests, that it would have been mitigated. And let me just close with a thought that going back to something where the biggest digital divide will turn out to be the gap between what we could have been doing and what we weren't. I am still astonished that I can't go on the web and just put in my zip code and immediately find out how many cases there are in the immediate area, not just the zip code, but the immediate area, and also where to get testing and also where to get treated. Those are the three most important questions. There ought to be a reliable source of information where I can do it really quickly. And by the way, whereas I think what Google is supposedly doing might have some value, I think a lot of people are going to be very reluctant to put personal health information on the internet. So I'm not sure that what they're talking about is really the first thing that needs to be done. But my big point is, I just hope we learn from this about how to address in all kinds of different ways this crisis and the next crisis, using this incredible platform that really needs to be uniform and universal, not uniform, universal. And with that, I will sign off. Drew, thank you so much. Olivia, John, great to see you guys again.
Thank you very much for being with us, Blair. We're going to continue, to our listeners, we're going to continue. I will remove Blair from the stream. And now I want to turn, Olivia, we kind of interjected there. Did you want to finish a point? But I do want to go to John to talk about the 12 points, at least in summary form or outline form. So let's go ahead and do that here.
I'm sorry, Drew, did you want me to talk next, or Olivia?
Olivia, if you have something specific, great. Let's go to John then, okay? Go ahead, John.
Okay, well, thank you. A few of these I mentioned already: extending the filing window deadlines for rural healthcare applicants, clarifying that schools and libraries can allow their Wi-Fi networks to be shared with the community. I've talked about that already, but just to emphasize that the FCC 6th report and order back in 2010 already allowed allowed schools to make their Wi-Fi available after school hours. And basically, now that schools are closed, every hour is after school hours. So that should be something the FCC can say that they will permit right away. The FCC could also waive the gift rules there are certain providers that are willing to donate their Wi-Fi hotspots or software or equipment to students. In the past, that the FCC has had detailed rules about when that's allowed and when it's not, for fear that they don't want to run afoul of the open, fair and competitive bidding process. But now I think it's a different situation where these charitable donations really ought to be made available, and the FCC could clarify that right away. There are also things like the encouraging the ISPs to extend affordable broadband offerings. It's great that Chairman Pai was able to use his bully pulpit to get commitments not to disconnect people. And that's wonderful for those who already have connections, but it doesn't do anything to get new people on the network. And a big thing that the private ISPs can do is develop these or implement or augment their offerings for low-income people to be able to subscribe to service at a very fair discount rate. Most of the broadband pricing right now, it's really unaffordable. It's often $50 to $70 a month. And frankly, the current Lifeline discount of $9.95, that's not enough to convince a low-income person to subscribe to broadband. The price for the broadband connection really needs to be around $10 a month.
John, could you speak?
I'm sorry, Drew? Drew, I lost your connection, I believe. Go ahead.
Yeah, we're back. I had some buffering errors too. Could you just speak to this point about making anchor institutions, as we've called them, libraries and others, kind of universal points? You referred at the top or at the start to some difficulties in doing that under current authority, but could be clarified. Could you just specifically emphasize the recommendation, the problem that they're facing, and the recommendation that would enable more access to broadband?
So the E-rate statute says that subsidies are provided for schools and libraries to have telephone and advanced services broadband capability for educational purposes. And the FCC, the issue is, how do you interpret the educational purposes limitation in the statute? So the FCC has assumed that everything that's done on campus in the school or library is by definition an educational purpose. The gray area is if you extend that signal beyond the school or library, is that still meet the statutory requirement for being an educational purpose? And it's a bit of a gray area where the FCC's rules are not crystal clear. Sometimes it's said that's okay as long as it's incidental or supplemental use. Other times there's a Boulder Valley, Colorado school district that tried to extend wireless signals from the school to the low-income housing project next door, and the FCC called them up and told them no, they couldn't do that, that they were going to lose, that violated the E-rate rules. So schools and libraries are getting some mixed messages here, but now is not a time to quibble about these rules. The FCC should really take the bull by the horns and make it clear what is available. And as again I said earlier, these are publicly built networks through a fee on your telephone bill. So the public is paying for these E-rate networks and these rural healthcare networks. So the public ought to be able to maximize the benefit. We already have a lot of these networks already built, and there's capacity lying there that could be used without any additional cost if it's opened up and the rules are made available so that consumers could use that. Now, having said all of that, that's what the FCC can do with its existing authority.
Yes, exactly. Thank you for making that clear.
Yeah, Congress can do more than that. And I'm a little surprised that Congress is talking about using the E-rate program to fund broadband to the home. Because if you try to run it through the E-rate program, then you get caught up in a lot of the E-rate rules and regulations that USAC administers, but USAC does not always operate very efficiently. No offense, Olivia, but there is an advantage that Congress has now to create a new program that could avoid some of the bureaucracy that is currently part of the E-rate process, part of the rural healthcare process, and create a new program that could get the money flowing much faster. And I think it's incumbent on the FCC and Congress to look at the general authority of the Universal Service Fund under Section 254. Rather than ascribing these programs to any one of those 4 USF programs, the FCC should look at its plenary authority to administer the Universal Service Fund, which calls for all Americans to have affordable access to communication services. So I think the FCC and Congress should look at the broader authority under the Universal Service Fund in order to create new programs and get this funding going more quickly so that people can get online faster.
Thank you. That's an excellent summary. Go ahead, Olivia.
The Lifeline program's role in all of this the broadband built out is the affordability piece. So for those households, if you build it, can they pay for it? Lifeline comes in with if you're low income, this is how we will help you pay for it. Piece of that whole sort of larger puzzle. So I don't think we need to create a new program, but sort of take a look at that Lifeline program. The infrastructure is already in place to administer that program. It's ubiquitous around the country and territories and in tribal lands, and it can play a more robust role, certainly now in the COVID-19 response, but moving forward in this larger picture of how do we get to universal services. So I didn't want to lose that or sort of leave anyone with the impression that, in terms of affordability, we need to redesign something. I think we just need to take what we have and work from there. It's a good starting point.
Well, and I just think it's a very useful frame to think about, what we can do, what the FCC can do under its current authority, and what Congress could do. And John, it's great to raise this issue now about if we're talking about a stimulus, a package, which clearly is being discussed, what could be done to change things, to offer new opportunities. And I want to specifically ask about ways to, I don't know, for lack of a better word, build on the Recovery Act of 2009. John, are there things that you've already heard discussed that would, I mean, again, there are bills out there. There's infrastructure bills before this crisis came up that people had talked about. Are you actually thinking or hearing that it would make sense to start to pull some of those measures into a package that might be considered right now by Congress to address the coronavirus?
Well, we certainly endorse the idea that Congress should provide greater funding to build out these networks. The BTOP program from the 2009 stimulus bill was by and large very successful. About 90 to 95% of those middle mile networks were built and operated and are still operating today. So we think that program worked, but it was focused on middle mile. And I think today we need to focus more than ever on the last mile and getting those connections directly to the premise of not just the schools and libraries and health, but also the other anchor institutions, and to broadband to people's homes and residences. And that really should be the focus. So the House has been considering a Lift America Act, which proposed, I believe it was $40 billion in new broadband spending. And we've been supporting that bill, and we think that's the right direction to go. But I will note that these broadband, to build those networks, these broadband funding programs will take some time. The BTOP program, I think, took 3 or 4 years to build out those networks. And there may be a similar period of time for the Lift America Act to actually build out those networks. So we need to be looking at short-term, immediate fixes to this current crisis, as well as long-term fixes, so that we're prepared when the next crisis comes. As Blair said, we need to work in between these crises to solve these problems. And I think that's where the 40 billion or perhaps the 80 billion that's also been talked about by Congress, I think that money could come in to help us avoid the next crisis.
Well, and to recap, you've definitely raised issues about changing some of these rules. Olivia, you've had the 2 points about unlimited minutes and also making use of non-ETCs and so forth. And John, you've raised issues of clarifying certain rules. We focused a little bit on the rule about access from a school or other anchor institution, as well as this important deadline, in addition to other deadlines, right? But this important deadline of the healthcare fund. I want to turn to Olivia. I don't know if you've had a chance to look over the 12 recommendations that John has referred to in their letter yesterday, the Shelby Coalition's letter. Whether you have or haven't, do you have reactions on some specific emergency measures that could be done right now to confront this, in addition to those we've talked about and that you've talked about too?
I haven't had a chance to, but everything John said makes sense. And I'm hoping that in addition to sort of looking at what the FCC can do, what Congress can do, to build on the voluntary efforts of the companies, some of the affordable broadband packages have a 90-day waiting period, and some of them prohibit people who have, prior arrearages from signing up. So, waiving those barriers to entry would be good, I think, if we're trying to do something right away to get people connected, keep them connected. That would be my plea. So, John, I don't know if those are in your letter, but I hope so.
Mm-hmm.
Yeah. Well, awesome. Why don't we got just a few minutes left. John, in a minute or two, do you have any kind of final thoughts and reflections on what can happen now, what the FCC and, as Olivia said, private companies can do? What are some things you've heard of that might make sense for some of the nonprofit institutions you frequently work with can do that they haven't done yet?
Well, there are a couple of other spectrum-based items that the FCC could handle, which we haven't mentioned yet in this webinar. So I'll just mention them quickly here, because a lot of times building out wireless networks can be done more quickly than deploying wireline. And so given the state of the emergency here, the FCC could, for instance, make EBS licenses available to schools and other educational organizations. We submitted evidence in the EBS proceeding at the FCC last year that the schools and educational groups and nonprofits are much more likely to deploy EBS wireless services than the private sector. And that's not a knock against the private sector. They're doing a lot, but in a lot of these rural markets, it's not economic for the private sector to be able to deploy these services. But if you give the licenses to the schools or the nonprofits that are based in that community, they have an incentive to get the service deployed. And that could be a big help to solving the homework gap if you could get students connected via wireless EBS signals at the 2.5 gigahertz level. It's a very robust piece of spectrum that could go a long way to solving this problem. Also, TV white spaces. And this is something the FCC has been working on for quite some time, but we think the FCC could finalize those rules to increase the power limits to allow the use of TV white spaces. That's an unlicensed set of spectrum that is just waiting for the FCC to finalize those rules. And a lot of wireless internet service providers, they already have licenses, and they just need a little bit more funding to be able to extend their service out to some unserved areas. So there are a number of spectrum-based things that we'd encourage the FCC to look at very quickly.
All right, Olivia, do you have any final quick remarks about how the agencies, the private sector, and others can help respond through broadband to the crisis?
I think it's an all hands on deck. To reiterate the two things the FCC can do. Number one, get rid of, require unlimited minutes for those Lifeline customers. Unlimited minutes and texting. I think number two, the program do what happened in Katrina, take that next step, allow non-ETCs to offer robust broadband support and increase the support amount for that Lifeline broadband benefit. There's a sweet spot in there. I think that builds on the voluntary efforts of the private sector. The private sector is, kudos to them for stepping in. with the stop
Yeah.
disconnects, keeping people connected. But again, you know, the 90-day waiting period, get rid of that for low income. Get rid of the rule if you've had a past arrearage or block from those, you know,
Right.
low cost benefits. I mean, low cost services. I think that will really help expand the reach of those programs to a lot of households. I think that there's things that you know, John had mentioned the congressional efforts, and you know, those are very important as well. There's things, so all
Great.
together, these things can sort of happen immediately, like right now, into the near future.
Yeah.
It's a good glide path.
Well, wonderful. We are out of time, but before I sign off completely, I want to invite our audience to join us tomorrow. We're going to be at 12 noon Eastern time. We're going to be talking about teleworking and some ways and tools that people are working on and deploying on teleworking. And on Friday, we'll talk about some of the stresses that the network is impacting. Yesterday, we heard from ISP groups that said there's 30 to 60% increase on their networks at certain hours. We'll talk in greater detail about that. And then on Monday, we hope to be talking about some of the issues of access for low-income communities and making sure that they are not disconnected. Thank you again for watching. Please follow us at broadbandbreakfast.com and sign up for the YouTube channel so you'll be informed of future events. Thank you. Take care.